My name is Joanne Beckman, registered nurse. Heart failure affects 5 million patients in the United States alone. It is a frequent cause of hospitalizations, office visits, and increasing financial strain for not only patients and family members, but also for insurance companies. Keeping patients healthy and out of the hospital is one of our most important goals. Today, I'd like you to visit with me with Lydia, a patient with heart failure, as we review the signs and symptoms and tips for not only the patient but their family on how to stay healthy and out of the hospital over the holidays. Please join me.
Hello. Hello.
Hi, Lydia. May we come in?
Certainly.
Thank you. Lydia, today I would just like to review some of the symptoms of heart failure. I know that you have a very active family and are looking forward to traveling and visiting them with new grandbabies.
Great grandbabies.
Great grandbabies. Great. But we want to make sure that your treatment is keeping you as healthy as possible. So today I'd like to review some of the signs and symptoms. Have you noticed any increasing shortness of breath?
Yes.
And is that more when you're just sitting or more with activity?
Activity.
Activity.
Especially with exercise.
Exercise. And a lot of times that can be from fluid buildup. Have you been doing daily weights?
No.
And I'm sure that that's something that your doctor's office has reviewed with you quite frequently. And I want you to think of daily weights as a diabetic monitoring their blood sugar. It's very important to measure your weight every day at the same time. We recommend right in the morning after going to the bathroom. Any increase of weight of more than 2 to 3 pounds needs to be followed up with your doctor. Now, any fatigue with exercise?
Very much.
Very much. And so with fatigue with exercise, what we want you to do is to really pace yourself with that. We don't want you to exercise after a large meal. So we want after a meal to rest. But we encourage you to start with 5-minute exercise and then increase that gradually as you can.
How much time after I have a meal that I can start exercising?
I would probably wait a good hour and a half to 2 hours because the blood flow that helps with the exercise is digesting your food. So we want you to rest at that time and then to space it out. So rest periods and then to move on. Have you noticed any swelling of your ankles, or are those looking pretty well?
They're looking pretty good, yeah.
Okay, and again, that is a buildup of fluid from the right side of your heart. So if you start noticing that you've got an increase in swelling in those extremities, again, need to monitor that weight on a daily basis because all of those tied together may indicate that you've got excess fluid.
Would one ankle be more swollen than the other?
Should not.
Okay.
Sometimes you can have swelling in one leg or the other, but most of the time it's going to be in both legs with that. Now, you're on quite a medical regime with many medications that I know that he has you on, and your diuretic is very important because that is helping you get rid of the excess salt and fluid. Now, sometimes when we travel, especially going through airports, we want to maybe not take that diuretic or those types of things. We do not recommend that at all. It's very important that you take your medication every day at the same time as prescribed by your doctor. Are you having any difficulty with that?
No, I take it early in the morning so I don't have to be up all night.
That's great. And continue taking your ACE inhibitors and your beta blockers also, because those all help to protect your heart and to help with a force of contraction with those. Now, some of the other symptoms that you might be having is, do you ever have any abdominal bloating?
Very much.
Okay. And abdominal bloating also can be from an excess in fluid buildup. Sometimes we also see a decrease in appetite and nausea. And again, those are all symptoms that we want you to keep track of and to notify your doctor with, especially if you have an increase in your weight that's going on.
Okay.
Now, the diuretics also, sometimes you can lose potassium, and I know that he has you on a potassium supplement. So again, it's going to be very important to monitor for any leg cramping that you might have. That's not a sign from the heart failure, but from a possible low potassium.
Okay.
Now, when do you need to call the doctor or the ambulance? And when do you need to go to the hospital?
Well, mainly if I'm extremely short of breath. I mean, the other symptoms went,
Extremely short of breath. So if you are having chest pain, shortness of breath, can't catch your breath, we want you to dial 911 and call that ambulance, because they can start treatment in the ambulance that is going to expedite your care. To call and notify your doctor, as I mentioned before, it's important to call if you have any leg cramping, if you're having increasing shortness of breath, because the heart failure clinic, you're able to be seen there. And again, they can monitor your medications and your regime and possibly increase your diuretics or change any of your medications, which again will keep you out of the hospital. So anytime that you have increasing shortness of breath, if you're not able to sleep in bed at night, that you find yourself in the recliner, increasing coughing at night, again, can be a sign of increasing congestion. So it's very important to notify him of any of those changes. Now, with the holidays coming and talking about a lot of fluid buildup, now is the time to start planning those holiday meals. Not that you're going to be cooking, but to have those conversations with the individuals that are. Recommend that you find out how they're going to cook their turkey, because we want you to stay away from any added salt and to monitor your fluid intake. So it's going to be very important to have that conversation that a fresh turkey, and not one that's basted, is available, because sometimes we can have slight increases in salt and not even know that it was prepared indirectly. So I want to encourage you to kind of review your nutritional and dietary needs there. Make sure that that green bean casserole is not with that cream of mushroom soup. We want that low sodium. So to look at all of those different things. Are you doing very well as far as monitoring your salt intake?
well, I never cook with salt, but I don't look at the ingredients on cans very well.
And again, it's very important to monitor what is in the can, and if you're doing any restaurant dinners, to ask them how they cook those, because again, we want you to stay away from any added salt, but to look for those hidden areas. It's also very important not to take any non-steroidals, such as like Motrin, because sometimes that can affect the way that your kidneys excrete urine because it blocks with the diuretics.
I wasn't aware of that.
And so sometimes when we have a flare of congestive heart failure, it is because of some of those little idiosyncrasies. And again, our goal is to keep you healthy and out of the hospital this year.